Good afternoon, dear students. Today we will see one of the most important chapters of KT, that is manual muscle testing, MMT. So these are the points which we will be discussing, that is introduction, definition, purpose and uses of MMT, and grades of MMT. Regarding introduction, so muscle testing is an integral part of physical examination. It provides information that is useful in differential diagnosis, prognosis, and treatment of neuromuscular and musculoskeletal disorders. So why this MMT is important? To rule out the differential diagnosis. Example, taking the case of shoulder joint, there are n number of conditions of shoulder joint. So to evaluate which condition the patient is suffering from, for that MMT is required. Let's say rotator cuff muscle is involved, or biceps muscle is involved, or supraspinatus muscle is involved. So depending if we perform the individual muscle MMT, we will come to know what is exactly the muscle is in which grade, and from there we can differentiate the patient is suffering from which condition. Second is the prognosis. So whatever treatment we have decided for the patient in terms of strengthening, as it is something related to strength. So the protocol decided will be related to strengthening. So the protocol which is fixed by us, it is really going on the right path. That can be judged by the MMT. And second, the treatment. For example, further we will see there are different grades of MMT, like grade 0, 1, 2, 3, 4, 5. So the treatment of the particular muscle related to strengthening of that muscle will be decided upon the grades of the MMT. MMT is used to determine the capability of the muscle or muscle group to function the movement and their ability to provide stability and support. So MMT is used to determine the extent and degree of muscle weakness. The originators of MMT were William Wright. Now we will discuss the definition of MMT. So MMT is a procedure for the evaluation of strength of individual muscle or muscle groups based upon the effective performance of a movement in relation to the force of gravity or manual resistance through the available range of motion. So basically in this, the patient is instructed to perform the movement first in the anti-gravity motion, and then if the patient is unable to perform the anti-gravity motion, then the role of gravity is coming into the picture. So that is what is the MMT, and henceforth MMT is the most vital part of motor assessment. Now we will see the basic difference between individual muscle as well as group muscle MMT. So muscle with a common action or actions must be tested as a group, or each muscle may be tested individually. For example, flexor carpi ulnaris and flexor carpi radialis muscle may be tested together, and the role, if they tested together, is wrist flexion. But if flexor carpi ulnaris may be tested more specifically, if we instructed or if we perform wrist flexion with ulnar deviation. And on the other hand, flexor carpi radialis longus and brevis may be tested more specifically in the action of wrist flexion with radial deviation. So if the wrist flexion is cumulative, then both flexor carpi radialis and ulnaris are coming into the picture. And if individual muscle MMT is to be performed, then flexion is performed in radial deviation for flexor carpi ulnaris, and flexion is performed in ulnar deviation, flexor carpi ulnaris. Next point is purpose and uses of MMT. So why MMT is necessary, or why MMT is important? First, the severity of the problem can be understood. As we discussed, it is used as a diagnostic tool for planning the treatment goals. So if the patient grade we will be rating, let's say if the patient muscle grade of biceps is in grade 3. So depending upon that, we are supposed to plan the treatment goals. For that, MMT is mandatory to determine the extent and degree of muscle weakness resulting from the disease. And that is why MMT is considered as the important tool in clinical evaluation. And it is useful and helpful in evaluating the effectiveness of the treatment for the therapist. Talking about the grades of MMT, so there are different grades of MMT, but the most important grade of MMT is the MRC grade. So in today's lecture, we will see MRC grades of MMT. So there are basic 5 grades of MMT, that is grade 0, 1, 2, 3, 4 and 5. So grade 0, that is no contraction. Grade 1 is flickering of contraction. Grade 2 is full range of motion with eliminated gravity. Grade 3, full range of motion against gravity. Grade 4, full range of motion against gravity with moderate resistance. Grade 5, full range of motion against gravity with maximum resistance. So now we will see these grades one by one. So what is grade 0? Grade 0 is no contraction. Means if we are instructing the patient to perform elbow flexion and if patient is unable to perform, that is what is grade 0, that is no contraction. Grade 1, flickering of contraction. So in grade 1, you won't be able to see patient is performing entire elbow flexion, but you will see the patient is at least attempting to flex the elbow. So that is what is, you can see the contraction, that is flickering of contraction, which is grade 1. Grade 2, full range of motion with eliminated gravity. So here, patient is instructed to perform elbow flexion in gravity eliminated plane. For example, imagine shoulder in 90-degree abduction and then instruct the patient to perform elbow flexion. So that is what is grade 2 for biceps muscle, that is full range of motion in gravity eliminated plane. Grade 3, full range of motion against gravity. So if the patient is instructed to perform elbow flexion either in standing or in supine, that will be grade 3, that is full range of motion against gravity. Grade 4, full range of motion against gravity with moderate resistance. So in grade 4, the therapist is supposed to apply the resistance in the opposite direction to that of the action desired. Let's say elbow flexion. So patient will be performing elbow flexion and the therapist will be giving resistance in the direction of extension. But the resistance should be moderate. So the moderate resistance here can be linked with, depending upon the patient, the therapist is supposed to apply the resistance. So this is what is grade 4. Grade 5, full range of motion against gravity with maximum resistance. So this grade 5 of maximum resistance is linked with the maximum resistance of the therapist. Therapist is supposed to apply his or her own maximum resistance for grade 5 to evaluate the muscle. So these are the 5 basic grades of MMT under which we will be discussing and demonstrating individual muscles of upper limb as well as lower limb. And the most important part in grading the muscle is whenever we are progressing the muscle, whenever we are supposed to assess the muscle, we are always supposed to progress with grade 3. So considering an example again of biceps muscle, first instruct the patient to perform range of motion against gravity, that is either in supine or standing, that is the anti-gravity. If the patient is able to perform grade 3, then you can progress to grade 4 with moderate resistance. If the patient is able to withhold the grade 4 resistance, then we are supposed to progress to grade 5. But if the patient is unable to perform grade 3, that is full range of motion against gravity, then instead of progressing it to grade 4, we have to make the patient position in such a way that the gravity will be eliminated. That is grade 2, shoulder abduction, and then instruct the patient to perform elbow flexion. Due to the patient is not in grade 3, so the patient won't be able to perform grade 4 and 5. That's why we are supposed to go a little down, that is grade 2. So these are what the basic MRC grades of MMT. Thank you.